In keeping with the method described by Surendra Basti, the phimotic and fibrotic anterior capsule is treated with the catalyst femtosecond laser to create a new capsulotomy, and relaxing incisions are produced to reduce astigmatism. In the operating room, under visco agent, a 2.2 millimeter clear corneal temporal incision is created, and microforceps are used to free the laser cut anterior capsule edge. A Donnenfeld spatula is used to separate the anterior capsule from underlying anterior surface of the IOL, and then with blunt and visco dissection, the capsule is separated from the anterior surface of the lens for 360 degrees. Using a Sinskey hook, one edge of the optic is elevated and then grasped with microforceps in order to free the inferior haptic of the single-piece multifocal acrylic lens. Visco dissection and blunt dissection are used in the tunnel created by 3 years of time fibroproliferation and regeneration of cortex. As one can note, the attachments to the capsule bag are rather tenacious, but with careful and gentle blunt dissection and visco dissection, eventually the loop is freed from the capsule fornix. Interestingly, the superior loop shows very little in the way of adhesion to the capsule. Working through the 2-2 incision, an MST microforceps and scissor are used to transect the lens, which is then removed through the 2-2 incision. The capsule bag is then swept open, and the regenerative cortical piece is removed by coaxial IA. A Verify Plus device is then used to measure the appropriate intraocular lens power, after which cleaning of the anterior subcapsular lens epithelial cells is carried out for 360 degrees with a Singer sweep. Following this, an appropriately powered single-piece acrylic monofocal lens is then implanted into the capsule bag, and the visco agent is removed from above and below the lens, intraocular pressure set at physiologic levels, and the incision then tested with fluorescent dye and the manner of a Seidel test. Here, 6 months following surgery, we can note no phimosis of the anterior capsule, a perfectly centered single-piece acrylic lens, and vision improved to the 20/25 level.